there, it's Taryn, I'm back. Okay, so today I would like to demonstrate how to use, how to administer medication subcutaneous. Let me just get to the point, right? Okay, so before I actually demonstrate that, I want to go over some key points, okay, that you should keep in mind. So, subcutaneous is also referred to as subcu. That's the medical abbreviation of subcutaneous, okay? So when you want to give a medication subcutaneously, you would want to choose a site. That's important, right? Knowing where you're going to give it. All right, common sites are your abdomen. And when you choose your abdomen, you want to go 2 inches away from the umbilicus, your belly button. And usually you can measure by using your fingers and, going 2 inches away, like that, okay? And also you can use the arm. And usually you'd use the posterior part of your arm because that's where more fat is at. And then you can also use your thigh, and usually it's best to use the inner thigh, okay? And then you want to take in consideration, well, I'm giving a subcutaneous injection. What needle am I using, right? That's important. So the needle size is 3/9 to 5/8 inches. And the gauge of that actual needle, meaning the bevel, that open area where the medication's coming out of, is 25 to 27 gauge needle that you'll be using. And then also, what angle will I be using? Because when you administer something, it's obviously at an angle, right? When you're injecting something. So you will be injecting at a 45 to 90 degree angle. And usually for that 90-degree angle, that's for your obese patients. Okay? And then, so what's given subcutaneous? I don't know. It's like kidding. What's given is your insulin, your heparin, some epinephrine. You can do some other allergy medications. And also some opioids are given subcutaneous as well. But primarily, you would see insulin and heparin given in that way, in that route. Okay? And then we go back to why. Why are we doing this? Why are these medications given subcutaneously? And the reason being is because there are less blood vessels in that in the connective fatty tissue right underneath the skin, which causes the medication to absorb at a slower rate than other medications. So that's why we give insulin and the heparin subcutaneously, because it absorbs slower. Okay. And they need to be. And then one question I have for you. Hey, do you pinch the skin? I hope so. Because, and hold on. So whenever you're giving an injection, you want to pinch the skin before you actually inject, okay? And also do not aspirate the area after, because these two things, pinching the skin and not aspirating the area, it basically prevents trauma to the injection site. So no hematomas, no bruising, and things of that nature, and also the absorbing of the medication. You don't want to interfere with that, okay? So you want to make sure that you pinch the skin and you don't aspirate afterwards, okay? So now that we went over the basics of subcutaneous, now I can demonstrate actually how to do it, right? Everyone wants to know that part. Well, how do I do it? Well, you gotta know this first, right? Okay, well, anyways, okay, let me bring you down here on my phone, not that you care. And I hope this is focused. There we go. Okay, so I will demonstrate on this little skin that I brought on Amazon. So you want to wash your hands. And when I'm at work and I have to give any type of injections, I always wash my hands with soap and water, just because we're working with skin and it's open area, so just reducing the infection rate and all that, and bacteria, okay? It eliminates all that. And then you want to get some gloves. I have my gloves over here, okay? And I usually drop my insulin before I actually go in the patient's room. Okay, so today, hold on. What was I going to say? I lost my train of thought. Okay, so I want to actually show you an insulin syringe on how you can tell it apart from other syringes. Okay, so it says units here, and that's how you know that you have an insulin syringe and not any other syringe, because other syringes are by mLs, but insulin only, you can only give insulin by units, okay? So that's how you determine whether or not you have the right syringe to use, okay? And then, so that's that. Let me put on my gloves. Let me apply my gloves. And while I'm doing this, I want to mention, before you give insulin, mostly some patients are on sliding scales or they have standard dose, and I'll talk about that afterwards, okay? All right, and next, oops, that flew right out of my hand. Okay, you want your alcohol swabs because you want to scrub the hub of the vial. Okay, make sure that's clean. Okay, remember eliminating all that bacteria. Okay, and then let's say we're given 5 units. I'll draw back 5 units of insulin. I'll draw back 5 units of air, in the syringe. Okay, and then I'll put the air inside the vial. And then I'll invert it and draw back my 5. And the reason I put the air in is because it eliminates those air bubbles that all of us nurses hate. Okay, and then I have my 5 units. I'm going to close this cap slightly, okay, because then I'll want to go and give it to my patient, and you don't recap. Okay, so now let's say that we're back, hypothetically speaking, we're in the patient's room. I washed my hands again. I applied new gloves. I chose my injection site, and let's say I'm doing the abdomen, 2 inches away from the umbilicus, right? I'd scrub in a circular motion. Okay. You'd wait for the area to dry. You don't want to blow or try to air dry it. You wait for it, patiently wait. Takes a couple seconds to dry. Okay. And then you have your 5 units drawn. You pinch the skin and you insert it. This is a 90-degree angle straight down. Oop. Insert it. Pull back, and then retract this. You wait for that click, and now it's locked. And then you dispose of your syringe, any syringe, inside your shots container. And you'd, let me move this over here. Take off your gloves and wash your hands. Okay, and that's all there is basically to it. And I can also do a video on how to actually mix. I know you guys are looking like that's regular with the MPH app. I can do a video on how to actually mix insulin. So if you want that, just request it in the comments below. And I wanted to go back on talking about the sliding scale. So when you obtain the patient's blood sugar, some patients have sliding scales, and what sliding scales are basically a parameter of range of blood sugars where they where the levels fall at. So let's say someone's blood sugar, the healthcare provider says, okay, your patient's blood sugar is in the range of 151 to 200. You would give 2 units. And then 201 to 350, you would give 4 units, okay? So that's a sliding scale. And you usually go, those are for your short-actings. You give your short-acting insulins based off a sliding scale. And usually your long-acting, like your Lantus, your Levemir, those are usually standard doses that patients get. And I can also go in depth in another video on that, but before you even inject any insulin, you want to make sure you check your patient's blood sugar, check if they have a sliding scale, you know, and even if it's a standard dose, you always want to double check their blood sugar before actually injecting it, okay? So I hope that you enjoyed the video. I hope that was clear enough for you. And if you have any requests, please let me know, and I will be happy to make any video that you're looking for, any content that you're looking for, okay? Hope all is well, and bye.